Hi, and welcome to Orange County Car Injury Clinic. So let me share with you how we help whiplash injuries and help them get back to normal and decrease the likelihood of a permanent injury. So basically, when you have a whiplash injury, it's typically when you're hit from behind, it slams the head backwards. Now there's several things that happen, but basically what happens is the joints in the back of the spine get jammed together. That's typically one injury. A lot of times the discs get compressed. Typically that can be an injury. The soft tissue around the joints, especially the ligaments. The ligaments can have what's called micro tears in them, and that's very bad. That's a permanent injury. That's not good. And then sometimes that whipping action can affect the nervous system. We have tingling or numbness or even a mild concussion because of the brain is getting slams against the inside of the skull when you get whiplash. So how do we treat that? So your body goes through three phases of healing. There's the inflammation phase, the repair phase, and the remodel phase. And what happens is in the inflammation phase, it's treated with therapeutics to decrease the pain, the inflammation, the muscle spasms, the tenderness. And we use a combination of whether it's medications, analgesics, physiological therapeutics. So that's the focus in that inflammation. In other words, to help you feel better as fast as possible. Okay, the second phase is when your body starts creating scar tissue and new nerve regeneration from the injury. Now that gets to be very important because what happens if you do not receive physical medicine in that phase when that scar tissue is coming in there, the scar tissue is not as elastic, it's not as weak, and the nerves that are regenerating in there from the injury, they're more sensitive. So what does that mean to the patient? So if you don't receive physical medicine during the repair phase and it heals wrong like that, that's when you end up having stiffness, decreased range of motion, stiffness, pain, and discomfort. And it actually alters how the spine moves, causing accelerated pathological spinal degeneration, which leads to osteoarthritis. And osteoarthritis is the #1 disability in the United States. So this is a huge problem. So it's unbelievably important to get physical medicine in all three ranges of motion. Each joint in your spine or your elbow, every joint has what's called 3 ranges of motion: active, passive, and joint motion. And so chiropractic physical medicine treats all 3 ranges of motion. It's the only type of therapy, it's the only profession that treats all 3 ranges of motion: active, passive, and joint motion. That becomes unbelievably vital during this repair phase to decrease the likelihood of a permanent injury. And then the next phase is the remodel phase that goes into, remember that scar tissue is not as elastic, and there's more sensitivity there, so that's why we do more stretching and strengthening, because if we can get that new scar tissue strength back, it will decrease the likelihood of you having a permanent injury or re-exacerbations the rest of your life. That's why that is so important. It'll stop from having stiffness and pain and restricted mobility. That's how all of this comes together with the therapeutics. So that becomes very important. So in a whiplash injury, that's exactly what needs to happen to decrease the likelihood of having a permanent injury with the joints or the ligaments or the tendons or the discs or the nerves. So all of these are paid attention to with our medical team. And so we have a medical team with the core being the chiropractor that puts a lot of focus on the diagnostics and therapeutics for the spine. We have pain management team that helps with pain medication, analgesics, anti-inflammatories, things like that. Then we also have other medical team members like a neurologist, a neurosurgeon that we'll use if there's a potential disc bulge or disc herniation to get an evaluation there. And if you have any tingling or numbness, any nerve pinching, we'll get a second opinion from our neurologist team member. And if you have any mild concussion, we will send you to our team member who's what's called a neuropsychologist that helps evaluate the brain function after trauma. And if there's any fractures or extremity problems, that's when we send you for a second opinion to our orthopedist. So we have a whole team in place that is very well trained in car injuries, that's specific to car injuries. And at the very center is the chiropractor, because most of these injuries have spinal problems. They're spinal, and of course chiropractor is the best at treating the spine in all three ranges of motion: active, passive, and joint motion. So this is kind of how it all comes together, okay? But this is what happens with a whiplash injury, and obviously the goal is to get you through all three phases as much normal as possible, so you don't end up with a permanent injury to some degree the rest of your life. If there is a permanent injury to some degree, we have it all documented, and our doctors are qualified to testify in court if necessary to the mechanism of injury, the degree of the injury, the recovery, all of that, which is very unusual. A lot of doctors are not willing to testify in court on behalf of their patients. All of our Orange County car injury doctors are. So this is kind of how we very specifically what happens with a whiplash injury, some of the major factors and important considerations with your diagnostics and therapeutics, as well as the documentation and testimony, and especially having a medical team that we can pull anybody in for a second opinion with the specific, sometimes secondary injuries from car accidents. But overwhelmingly, they almost overwhelmingly are centric to the spine. And so that's why we have chiropractors who are the center, kind of playing quarterback, and then we have our medical team members as necessary depending on what we find out with your case. So it's comprehensive with the different medical team members, and it's comprehensive for all three phases of healing, as well as the documentation and court testimony. So this is how we help whiplash injuries. So if you've been in a car accident, suffering from a car injury, back pain, neck pain, headaches, dizziness, blurred vision, tingling and numbness in arms or hands, give us a call. We're pretty good about getting you in like that day you call or within the next day. We have what's called a 7-minute wait policy. When you call to come in, you'll see the doctor within 7 minutes. When you do come in, you won't be in our office more than 30 minutes, so you will not spend a half a day or a day in our office. We open as early as 9, close as late as 6, so you can either come in before work, you can come in at lunch, you can come in after work, so you do not have to miss work. So we make it very patient-centric. We pay a lot of attention to our patients to make sure we can fulfill your needs. And of course, the cost it's covered by your insurance. We do all the billing for you. If you have an attorney, we work with them. If you don't have an attorney and you want to get an attorney's opinion, we have some very exceptional attorneys we work with that we can refer you to. If you don't want to work with an attorney, that's fine too. We can give you the documentation that you need to submit also to the insurance company, okay? So we work with you in any of those fashions. So again, if you've suffered from a whiplash injury, give us a call. Orange County Car Injury Clinics, and we're right here in Santa Ana, California. And you can reach us at 949-207-7117. So it's 949-207-7117. Give us a call. We'll get you right in. We look forward to helping you today.